Hello, we are going to talk about Physiology, Lab Week 2, and this is where we're going to begin. We'll start with Einthoven's triangle. I might be pronouncing it wrong, but it doesn't really matter. Anyway, I broke it down in two separate, I guess you can say, transitions, and then we'll talk about the hexaxial system all in one right here. So starting off with Einthoven's triangle, just as it looks, it's an equilateral triangle, meaning that every time you will look at an electrical current, it's going to go into in a 60-degree angle. So remember that 60-degree angle is what it's going to make. Equilateral triangle, 60 degrees. So first one, a good way I like to look at it is, so you draw out your triangle, you put the right arm, and these, what I'm talking about, the right arm and left arm, these are where the chest or the electrodes are going to go. So there's one going to go on the right arm, on the left arm, and then the left leg. And they'll also have an electrode on the left left leg, or on the left leg and on the right leg, but the right leg is the ground lead. So that one's just kind of there, or not exactly what the purpose is, but it's a ground lead, so it's just there. And all the other ones serve the purposes in the equilateral triangle that I'm talking about. Well, every time the right angle or the right arm is going to go over towards the left arm, and whenever it goes in that direction, that's going towards a positive. So always remember, from the right to the left is going to be a positive right there. And then if you're looking on the QRS wave, the R is going to be in an upward peak, which will correspond with the 3 laws of the ECG that Dr. Ribby liked to talk about. It's included in the packet that we have, but I wrote it out on here. It might be hard to see. Whenever you're looking at limb lead 1 in particular, and limb lead 1 is the top of the triangle going from the right arm to the left arm. So whenever that's going towards the positive signal on the left arm, that's going to cause you to have an upward peak of the R on the QRS complex. And then if it goes in the opposite direction, that means it's going towards the negative, which will give you a downward peak R on the QRS axis. So that's a way to look at that. And then when we look at limb lead 2, that's going in a 60-degree angle towards the left leg. So that's the bottom of the triangle right here. Limb lead 2 going down to the left leg is a positive right there. So again, if you're looking in on the QRS complex, it's going to give you an upward peak. Same thing goes for limb lead 3 going down towards the left leg. That's also positive when it goes toward the left leg. So it'll go from the left arm down to the left leg, and it'll give you an upward peak of the R axis. And then if it goes in the opposite direction, clearly it gives you a negative, so it would give you a downward peak of the R axis. So moving on, and then another one within the 3 laws of the ECG, if you're looking at AVF, which AV stands for augmented voltage, so AVF, and that's the one, if you're looking at the hexaxial system, I drew it out in a smaller image right here if you want to look at that. That one actually goes directly down, which would be the same thing like here in the left leg, and that's positive when it goes directly down. If the AVF is going up, that would be negative here. So when it's going down, it actually will have an upward peak. It'll actually show up as a biphasic, which if you're looking over here on this side where I drew it out, the R and the S wave actually kind of look the same. You kind of can't distinguish the difference in the two of them. They're about the same height. Whether or not one's going up or one's going down, it's called biphasic right here, and that's dealing with the AVF. So if we're moving on and looking at the combination of the augmented voltages and the limb leads together, you can see I have in black, which are the limb leads, which is 1, 2, and 3. The augmented voltages are in red, which is AVR for right arm, AVL left, and then AVF for the feet. F stands for feet. So as you can look on here, those are all in red. Now, to transfer this over in accordance to what we talked about just earlier, if they ask about right axis deviation, which would be right over here, and it goes from 90 degrees to 180 degrees, extreme right axis deviation goes from 180 degrees to 270 degrees, and these also, if you get confused, because I'm saying 270 on here, that's what it says in our worksheet, but they'll also refer to these as negatives. Like it could be like from down here, from the normal axis over here, it goes from 0 to 90, and then this would go back to negative, or this would go to, I can't remember what exactly that would be, but these would be negatives on this side. So I'm just sticking with the positive numbers here. Left axis deviation goes from 270 degrees back down to 0, or 0 to 270, however you want to look at that there. And then I actually gave examples of when you will have these types of axis deviations. For example, right axis deviation typically goes along with people who have slender torsos, a left bundle branch block, or people who are adapted to higher altitudes. So if they do a lot of training, say in Colorado versus somewhere in the south, they're more adapted to higher altitudes. Extreme right axis deviation is the worst one. We don't want to have that. Definitely, it goes for the least healthy people, people with chronic heart disease, or if they have right ventricular hypertrophy. Typically, you'll see those people have an extreme right axis deviation. Now, those experiencing left axis deviation are typically people with an overly enlarged heart, or athlete's heart, that's an enlarged heart as well. People whom are obese, so abdominal obesity. Women whom are pregnant also you typically see left axis deviation, or people who have a right bundle branch block. We haven't really covered any of the right bundle branch blocks or anything, but I just saw that in the notes and figured it'd be good to have that down for example. And then everybody else, which hopefully most of us are, here in the normal area. And now again, just to review, anytime you're looking to find out which axis deviation people correspond to, you're focusing on the R wave, on the QRS complex. And then if you use these diagrams, you'll easily figure out where they correspond in here without even knowing what their history is, just by looking at the ECG. Now another note, just like remember, with the P wave, that's dealing with atrial depolarization, QRS complex, ventricular depolarization, T wave represents ventricular repolarization. Those are just the basics, and this would be the end of Physiology Lab Week 2.